Thank you, Mr. Chairman, and thank you, Secretary Price, for being here. I know that you have been to New Hampshire, and you appreciate that next to West Virginia, we are the state with the highest percentage of overdose deaths in the country. It has been a scourge that is ravishing communities and families in New Hampshire. And you sent a letter to me on May 24th, where you wrote that the Trump administration is committed to bringing everything the federal government has to bear on this epidemic. And President Trump, when he was campaigning in New Hampshire, said the same thing, said that he was going to make sure people got access to treatment. Well, I think this budget goes in exactly the wrong direction. There's a 23% cut to SAMHSA, and while, as you point out, there's more overall money in the budget, that's because this Congress last December passed the 21st Century Cures Act that included $1 billion, $500 million this year and $500 million next year to address the heroin and opioid epidemic. That money was meant to be on top of what we were already spending. And in fact, you say that the resources, we're not seeing outcomes that are improved as the result of these resources, because the resources are just getting to communities. In New Hampshire, we're just beginning to see the benefits of having the expansion of Medicaid to provide treatment for people who have substance use disorders. We're just beginning to see a pipeline that's developed because there is some certainty around payments. And you are proposing a budget that, with the House-passed health care plan, would cut $1.4 trillion to Medicaid. In New Hampshire, those people with substance use disorders are overwhelmingly getting treatment through the expansion of Medicaid, the bipartisan expansion of Medicaid in New Hampshire. What do you tell those people who are in recovery, who are getting treatment, about what they should do when you cut off those Medicaid payments that are their sole means of getting help for their substance use disorders?
Well, the reduction in Medicaid that's envisioned, in Medicaid resources that's envisioned in the budget is due to efficiencies and the ability of states to have flexibility in caring for precisely those individuals.
But Mr. Secretary, that isn't in effect what these cuts would do. What I'm hearing from treatment providers and from people in recovery in New Hampshire is that they don't have any other options, and that flexibility doesn't help if there's no other money and no other way to get treatment. The one thing that has made a difference for people in New Hampshire has been getting the resources to make sure they can get treatment, that there are people who can provide that network of providers that they need to help them as they go through recovery. And I think that's a much better use of resources than to cut people off and economically they have no place to go. I want to switch topics.
I would respectfully disagree with that characterization of what the plan is.
In your budget, you would, for the first time under any president ever, totally cut all funding from going to Planned Parenthood. In New Hampshire, we have almost 13,000 patients, both women and men, who receive their preventive and primary care through Planned Parenthood centers. That's not abortions, that's preventive care, mammograms, cervical tests for cervical cancer. It's preventive care. And what I've heard the representatives of the administration say is that, well, if we cut out those Planned Parenthood centers, then community health centers can pick up those people who are no longer going to get that preventive care. In fact, we don't have that capacity in our community health centers in New Hampshire to pick up those patients. So again, what's your proposal for how those women and men in New Hampshire who are no longer going to get care because those centers are going to shut down when the funding ends, how are they going to get their care?
Well, again, respectfully, I think that the amount of resources that are put forward for women's health across the entire department, $125 billion, would be spent on women's health, and that community health centers or health centers have actually an increase in funding.
But they don't have the capacity to provide for that coverage. And if the Planned Parenthood centers are providing good coverage for people. It's preventive care. Why do you want to shut them down?
Again, they may not have the capacity today, but that's what the increasing resources are for. And in fact, there are more health centers than there are the entities that you describe.
But you haven't answered why you want to shut them down.
The chairman mentioned at the beginning of this hearing the incredible nature of the previous administration using taxpayer dollars in ways that many Americans find to be abhorrent. And our goal is to try to make certain that we're addressing the concerns of all Americans.
Well, in New Hampshire, there's overwhelming public support for those Planned Parenthood centers, and I think that's true across the country. Thank you, Mr. Chairman.
Thank you, Senator Shaheen.